What can reading blood work the way I teach you do for you and your practice? That's what this podcast is here for, to help you learn the blood work, master it, and take your brick and mortar practice into the virtual world or scale your virtual practice. On these Thursday episodes, it's all for you practitioners. So let's dive in. And if you're not using systemic formulas supplements in your practice, you should be. This podcast is sponsored by my favorite supplement companies, Systemic Formulas and My Biome. Come join me inside their private Facebook group for practitioners called Systemic Formulas Clinical Nutrition. See you on the inside of that group, and let's start this round of the podcast. Here we go. Welcome to the Beyond the Diagnosis podcast with me, Dr. Kylie. I have a special guest, like all of my guests, but today the special guest is Brooke Kersten. She is a chiropractor who specializes in holistic health, and she has a journey that I want you guys to experience, especially you practitioners. Listen in, because Brooke has been a chiropractor her whole life. Well, since she got her license, I guess. But she's incorporated this blood work that I teach, and it's been a transformation. So I want to take you behind the scenes on what she did, how she integrated it, and what she's doing now to impact more lives, have more freedom, and more income at the same time. So, Brooke, welcome on.
Thank you, Dr. Kylie. Thank you for having me. It's such an honor and a privilege to be here with you today.
Yes, thank you. So, walk us through when you graduated chiropractic school, what happened next?
Yeah, so interesting. When I was in chiropractic school, I asked God if I could quit 3 times because I
think mine was 10,000 times. I hated that school.
I knew that I did not want to lay my hands on people and adjust them. As much as I love the chiropractic profession and have appreciation for it, I just knew that wasn't my lane. And I knew my lane was more holistic health / functional medicine. That was spoken over me when I was a young girl, but I just never had followed that path. So after finishing chiropractic school, I tried on chiropractic for about 3 months, and I was like, nope, this isn't for me. And then I was introduced to a program called True Cellular Detox. And I will say that it was life-changing for me in that I had some amalgam fillings in my mouth that needed to be removed properly, and I needed to detox properly. So I thought that was my niche. At the time, I thought that's what my lane was going to be, and I moved into that. I moved into that virtually right away and enjoyed it. But then I got connected to you, Dr. Kylie, through Systemic Formulas. I started watching your videos, and my heart just leaped for joy because everything that you were speaking about with how the answers are in the blood work made sense to me. And I am a person that strives for excellence. And I knew that if I could look at somebody's blood work and correct it through supplementation and nutrition, I have tangible results for the patient. And that's what people really want to see, right? So I dived right in with you, Dr. Kylie, and it's been a game changer for me. I will say that my best friend of several years recently said to me, she said, Brooke, she said, one thing about you, you have always been extremely passionate about the things of God, but I've never seen you so passionate about your purpose as you are right now reading the blood work. And, I can honestly sit here and tell you that every patient that I have taken on and seen thus far has seen changes in their results pre and post labs after doing the supplementation and the nutrition. So I love it. I'm excited about it. And I am often reminded about how the Bible talks about building your house on a solid foundation. And I feel like that is the key with the blood work.
That is so good. I love that correlation between that is such a strong foundation. And practitioners have a hard time like, okay, this is what I'm doing. How do I incorporate that? Now you went from, I tried chiropractic for 3 months, knew that wasn't my calling, same here as me. And we got rid of the chiropractic table. We haven't looked back since. Now,
Yes.
I have even referred my husband and my father out to another chiropractor, which I'm so grateful that they're there, they're doing those things. It's just not doesn't spark me. It's not my light, right? Even though I went through all of chiropractic school, wanted to quit 5,000 times too, and at least find a different route. But the whole real reason was we have this background, we have this knowledge, this expertise. Now let's magnify it and let's magnify our impact on others, which is the lovely thing of virtual. So
Yeah.
When you made that transition from TCD, True Cellular Detox, over to the lab stuff, what happened as a result?
Well, honestly, my practice exploded. I have been referral based up until this point, and I've connected with a lot of chiropractors in my city. I live in Atlanta, Georgia, and I've spoken to them. The chiropractors are referring me their patients. The chiropractors themselves have become my patient. And then my patients are with me for 3 months and they're referring me patients. So I think that's another thing too, that just has been confirmation that I'm in my niche, I'm in my lane, I'm in my purpose, because there's been extraordinary results. And as a result, there's been an increase in my practice.
Yeah. Did you change the prices in the meantime?
Oh, listen, I went with what you told us from the get-go. I never even hesitated on that.
$495 for a lab consult?
$495 for the lab consult and evaluation. And I have not had one person that has hesitated on that, because it just makes sense. And when it makes sense and people can see the value, they commit and they take action.
Yeah. Brooke, give me 1 second. So you did the $495 lab consultation, and then for your patients, for the practitioners who are listening, what happens after that? You read their labs, you sit down with them, you show them what's in their side their labs, correlate that with how they're feeling, and then what's next for the patient in your practice?
Yeah, currently in my practice, what's next is then they will buy the supplements every month and I will have them drop shipped to them. At this point,
do they work with you one-on-one after?
I have not done any one-on-one coaching at this point. And honestly, the reason for that is I just haven't had space to do that. So I put together some items that speak on nutrition and different things, and they just automatically get that all up front. And I think once you build trust with the client or the patient, if they want to go all in, they'll go all in, and they read through that material and they run with it. So, and one example I can give you is about a month ago, I got a type 2 diabetic patient. He's 70 years old. Someone had referred him to me. He said, Brooke, I am scheduled to have knee surgery in 1 month. And my doctor told me that she would not do the surgery unless my hemoglobin A1C decreased by at least 1% and my blood sugar was more stable. I said, okay. I said, no problem. Let me see your blood work, read his blood work, put him on a protocol with supplementation, and put him on a nutrition plan. He committed full on, just had his pre-op appointment a week ago, and his A1C had dropped by 1 point. And the doctor was like, I don't know what you've been doing, but whatever you're doing, keep doing it. Blood sugar completely stabilized. So
Cool.
I have not jumped into the one-on-one coaching, and I know there's definitely room for that to see an increase in the financial aspect of it. But I've just been sitting right now, or $495 for the lab consult and evaluation, And then they order the supplements from me every month.
The only thing I would recommend, because I love that model too, it just got so, my inbox got so plastered with people having questions along the journey, and I was spending so much time responding to it. It's like, no. There needs to be some type of follow-up with this. But what if we changed instead of buying supplements from a month to month thing, what if we got them buying 3 months or 6 months or 9 months or 12 months all at one time?
Yeah.
Now that's less you sending in the orders.
Yes.
And especially with the back order problem right now, I mean, they could order a month and 4 out of the 5 things are gone on back order.
That's a great idea, Dr. Kylie. And
so now you're saying, okay, what if, now I tell people this too. This is the exact conversation I have with people. So still it, ready? Okay. Because of the back order problem with the supply chain right now, I want to help you order more supplements up front so you don't have that problem when we get there. And not only that, I want to help you have less things to remember.
Yes.
So if you order 3 months of supplements right now, your first 3 months, even if it's a 90-day program, just have them order all of it. Say $50. Now that $50 comes out of your pocket, but now they're ordering a $1,200 order of supplements, not $300 or $400 each month. So you're getting more bang there. And then 2, like I said, with those back order problems, now they're not running into that dilemma.
Yeah.
And now you have less problems. You have less emails to send. So it's just a lot better. So do $50 for 3 months off. And then the hotspot, if they're doing 6-month programs, do you find yourself writing a lot of 6-month programs or not?
Yes.
Okay. So for 6-month programs, do $200 off.
Okay. Yeah.
90% of people will buy all 6 months at one time. You just have to offer it.
Okay. That's great. Yeah. I would say, 90% of my patients right now are on a 6-month program. I do have some on a 12-month program. But yeah.
6 months is like the sweet spot. So have them order all 6 months at one time, save $200 for shipping. Now that's one order, one email that you're sending for ordering it through Systemic Formulas. They're drop shipping it to the patient.
Yeah.
And now that $300 6 times became $1,200 one time or $1,800 one time.
Thank you.
Does that make sense?
Makes total sense.
When I made that switch, not only did people fulfill their plans at a higher rate, but it was just less hassle for me and my assistants on the back end, having to order and keep track of everything. And it's just one order for the duration of the treatment plan.
Well, and that's a great point too, because, if then I'm also keeping track of when everybody else needs to order their.
Yeah, that's a lot.
It's a lot of work, So
that you're not getting paid for either.
No.
So put it in their shoes. Say, let's get some bulk orders going. And then like if they get 3 months and it's a 12-month plan, if they do 3 months at a time, which is also a popular option, then they just email you like, hey, I'm ready for my month 4 through 6. Hey, I'm ready for my month 7 through 9. And they'll just email you. Now you don't have to keep track of it. You can always keep track of it and make sure people don't drop off. But usually if they're getting 3 months at a time, they're not going to drop off. It's the month to monthers that, disappear month 4.
Yeah.
But you probably have a better system than I did because I was so bombarded with it all. Now I didn't have a way to keep track of people. So if they dropped off, and I had no idea.
Sure. Yeah.
But as soon as I offered, hey, you can save $50, you can save $200. And then for the 12-monthers, invite them to save $300 off or it's just like getting an entire month free kind of thing. Okay. But I will tell you that the most popular option is the 6-month option because of that price range. It's around $1,800 price range.
Yeah.
And people can do that.
People can do that. And like I have one patient, he was like, well, went and got his labs done at the 3-month mark, right? And did not tell me that but he wanted to see what the viral bacterial infection protocol had done.
Yeah, they always want to do that.
And he was like, Dr. Brooke, he said, did you have on me for anything for my testosterone? And I said, no. I said, we were attacking the viral and bacterial infection. He said, my testosterone went up 200 points. So for him to see that in that 3-month difference,
Oh, that's so cool.
he then referred 3 patients to me that following week.
And you didn't even touch his hormones.
No,
That's the coolest part. Like,
just fix the foundation, Dr. Kylie, like you taught us to, which is that CBC with differential.
that's worth the price of gold.
Yeah. And,
Mhm.
if you throw things on top and don't fix that foundation first, you're always going to be reaching for the stars,
Which is why so many people go to, when you start reading blood work, this was my experience. They're working with a hormone therapist, some hormone clinic, who just does hormones, but then they start listening, they start realizing, oh my heck, there's more to it. It's not just I have low T and I need to go get testosterone. It's not just I have low progesterone and I need to get put on a progesterone estrogen cream or whatever it is. They realize my monocyte count is right here at 11.5. Holy smokes. I've been fighting a virus. No wonder why I'm so tired.
Yes.
No wonder why the thyroid medication isn't really helping, because they're bypassing that solid foundation of, let's just go from wherever you are to where you want to be, and let's get your body healthy. And as you follow that journey, using the blood work that determines what is inside that journey for you, symptoms go away. Yeah. So for him, not only his testosterone went up, but I'm sure his relationship with his spouse went up because now his libido is higher. He feels more confident because he can go to the gym and actually put on muscle. Like it trickles into their life like that. And all you did was attack a virus and a bacterial and fungal infection because of what was shown right there in his blood work that I'm sure he got told was once normal.
Yeah, he had seen and spent $2,500 in functional lab tests. And his wife actually sent him to me, and they've been trying to get pregnant for this past year. And she just the other day, and they are pregnant. So,
you're like, those are the best moments, especially when it's going from, because especially pregnancy and infertility, women are so hard on themselves.
Yes,
it's a two-way street.
It is. 100%.
And you got him healthy, and now together they get to reach this dream and not have to pay for some $25,000 IVF treatment that would probably not work because that's not the issue.
Right. Exactly, Dr. Kylie. And I just want to say to the practitioners who are out there and who maybe have like a fear or are intimidated by blood work, Dr. Kylie is gifted to teach. And she teaches it in a simple way that literally I was on her webinars with her. I paid for the training and literally was able to go out and apply it that following week. And so she gives you the roadmap. And if you follow the roadmap, you're going to see results with your patients. And that's what we ultimately are here to do, right? Our purpose as practitioners is to help people walk in optimum health, and finding the answers in the blood work and correcting that allows you to do that with your patients. So
yeah, and it doesn't matter if you're a health coach, it doesn't matter if you're a massage therapist or a registered dietitian or a nurse practitioner or an MD or a DO or a chiropractor, whatever your background is, you can relapse.
Yes.
And people are begging you to read their labs.
Yeah.
They're sick and tired of being told that their labs are normal, yet they feel like crap.
Yeah.
Exactly. And so I teach it in such a way that you don't have to have this expansive knowledge, this expansive background, because I'm going to take something that's scary and make it so simple that, just like Brooke said, you can literally learn it and utilize it the next day. You can even utilize it the same day.
Yeah, absolutely.
It's that simple. And so, Brooke, when you're talking about where you are from where you want to be, or sorry, where you were from where you are now with your practice, go back to chapter 1 in your story. What would you do different based off of what you know now? and how to build your practice and that kind of thing. If you were to start over with a blank slate, what would you do now?
I mean, at the time when I started, I didn't know what my niche was. So I say, I know we hear that all the time, but find your niche. And when you find your niche, that is when you are going to be passionate about learning the material and applying it. And so if I were to start over with a blank slate, knowing what I know now, I would jump right into being a virtual practitioner and then reading blood work and correcting blood work for my patients. Because I think the thing that we have to remember, y'all, is the majority of people see their primary care provider annually. So they already have the blood work. You just need to get the blood work and teach them how we read it differently in our profession versus conventional medicine. And it makes sense to them. Dr. Kylie, how many patients have you and I both had that have said, well, my blood work is normal, but I still don't feel well?
And that right there is a niche, whichever way you want to say it. When I was first approached, like, oh, you need to have a niche, we think about a diagnosis. We think about something that we can label and that be our niche. But what about all these people who don't have a label next to their name? So this is a niche. You can say, I help transform normal blood work into real answers, healing, and hope. So if you keep getting told your doctor keeps telling you your labs are normal, yet something's wrong, you're my person.
Yes.
Oh my heck, that's me. That's my aunt. That's my sister. That's my brother. That's my dad. People know immediately who that is. And just as you experienced, you transform one patient, they're going to start telling everybody and anybody they can. I had one, she was like, I talk about her case in the book a little bit, but she's 27 years old when she came to me, a mess on 15 medications, on 1,000 more supplements, just trying to feel somewhat better in some way, shape, or form. So I sat down, I read her blood work again over the virtual platform, Zoom, which is what I always use. And then her husband sitting next to her. Well, if that's what you can do for her, what can you do for me? So then we read his blood work. And then we read her mom's blood work. And then we read his sister's blood work. And then we read, like, it was just this effect that one drop in the lake had this ripple effect among so many individuals. And if you're hesitant and you're trying to think, one lab scared me, or two, I don't know what I would do with it, just start.
Yes.
Your practice, just like Brooke has experienced, will blow up. And it will be so easy for you to have more confidence in the treatment plan, take less time creating a treatment plan, and 3, asking for people to invest in your services.
Yes.
Do you have people pay you the $4.95 before you even speak with them?
Oh yeah, totally. They're usually people that are referrals. And I mean, we'll get on a 5-minute call and before the 5 minutes is even up, they're saying, okay, well, what do I have to do to go forward, to move forward? I'm ready, Yeah. So, and the beauty about reading the blood work is it ultimately gets to the root cause, right?
The root cause of literally everything. It's this journey of, why is my body presenting these symptoms? Okay, let's get my body healthy and watch as the symptoms resolve.
Yes.
And that goes from your patient with diabetes, that goes from testosterone, that goes from infertility, like it goes across the board. So people always ask me, well, what do you do for this? I don't care what the diagnosis is. I don't care what the symptoms are. I always go back to the blood work and follow that 5-step healing journey, because that's what the body needs to truly heal.
Yes.
So I'm glad you get it. I'm glad it's worked so well for you as well as many others. Brooke, give me one final tip of advice for any practitioner listening. What would be, like, if you could leave them with a golden nugget of advice, what would it be?
I would say that if you feel stuck in treating your patients and in that you're feeling like you just can't get them to that next level of health or that next level of optimum health, this is your place right here. Get in contact with Dr. Kylie and train under her and start applying it. And you will be amazed at the transformation you will see in the lives of your patients.
Not only that, but then in your practice too. How easy is it now to get new patients?
Yeah, absolutely. Yep.
And you're working less, making more money, having more impact at the same time.
Yes.
Cool. And then you're going to start selling supplements in 3 and 6, 9 and 12 month packages.
Yes.
And then you can throw in 1 or 2 follow-up calls. Really is all that is needed. Sometimes you can go heavier, but you can throw in like, hey, we're going to meet for 2 30-minute calls over the next 3 months. And then you add on another $1,000 to their package kind of thing.
Yeah.
But that way they're not bombarding your inbox and you're getting paid for all the extra stuff that you're helping them with. So cool. Thank you so much, Brooke. That was golden nugget. Those were many golden nuggets. If you guys haven't joined my Master Bloodwork Live virtual event yet, you can figure out when the next one is. Go to drkylieburton.com/masterclass. And that will be where you have all the details. And I will go through all the blood work with you in 4.5 hours, live virtual. If you can't make it live, that's all right. We have a recording. We'll record all of them and you have lifetime access to all those recordings. So you too can do the exact same thing Brooke is doing and many other practitioners. drkylieburton.com/masterclass. There you have it. Thanks, Brooke.
Thank you so much, Dr. Kylie.
Who wants to come hang out with me in Florida in February of 2023? If you're a practitioner, you have an opportunity to come join me inside the brand new live and in-person event, Orlando, Florida at the Wyndham Grand Bonnet Creek Resort. February 20th, 21st, and 22nd of 2023. Mark your calendars because registration begins in November with details out in November, and there is early bird sign up if you get in and join us before the end of the year. So stay tuned. This is for you practitioners. I'm going to bring you the best marketing, mindset, and business experts in the world, because this is something we all need, yet we don't receive. So mark your calendars, February 20, 21st, and 22nd. Not only am I going to bring you the best experts, but I'm going to celebrate your success with you. We're going to celebrate on that Monday night, that Tuesday night, and that Wednesday night. So you can fly in on Monday, but don't fly out until Thursday. Hang out with us and celebrate your successes, because the only way to measure success is to measure it backwards. This podcast is sponsored by my favorite supplement companies. If you're not using them in your practice, you should. If you're not using them and don't have them in your cupboard, you should. And by the way, don't get these on Amazon. These are counterfeit on Amazon. My favorite supplement companies are Systemic Formulas and My Biome. If you are a practitioner, come join me inside their private Facebook group for practitioners called Systemic Formulas Clinical Nutrition. Everybody else, join them on Instagram at Systemic Formulas.